morning, sir. I'm Singh from PPIPT5 class 21C. Okay, today I want to present our assignment. Our team title is mental illness, and we choose the title is schizophrenia. Schizophrenia is a mental health condition that usually appears in late or early adulthood. It also can appear in when old people, okay, or when the childrenhood, okay. It is impact of speech, thinking, emotion, and other areas of life can affect a person's social interaction and everyday activity. Schizophrenia is a very uncommon condition affecting around 0.25% to 0.64% of people in United States. According to the National Institute Mental Health (NIMH), it can have a profound impact of a person's life as well as life of those around them. When a normal person live around with the significant person, they also may affect. In some cases, a person will start show unusual behavior from childhood, but this only can become significant as they get older. In others, the symptom may appear suddenly. Significant is a lifelong condition, but we can treatment and help to manage to decrease the symptoms. Okay, what is the symptom of significant? Confused speech that is hard for others to understand, lack of the concentration, lack of the facial expression, lack of emotional expression. The people have significant is lack of connection with around people, and they also lost of confidence to talk too much with around the people surrounding. Okay, so today this is what I need to talk. Okay, thank you, sir.
Hi sir, my name is Puchuna Aina binti Muhammad Jasmine and my matric number is 19122168. I will continue on with the cause and symptoms of schizophrenia. As we all know, schizophrenia is a distortion in thinking, perception, emotion, language, sense of self, and behavior. Apparently, the cause of schizophrenia is unknown, but researchers believe that a combination of genetics, brain chemistry, and environment contribute to development of this disorder. Although the precise cause of schizophrenia is unknown, but contributing factors seem to increase the risk of developing and triggering schizophrenia, including having a family history of schizophrenia, some pregnancy and birth complications such as malnutrition or exposure to toxic or viruses that impact brain development, and taking mind-altering drugs during teen years. There are about 5 symptoms of schizophrenia, and the first one is delusion. Delusion is a firm held idea that a person has despite clear and obvious evidence that it isn't true. Delusions are extremely common in schizophrenia, occurring in more than 90% of those who have the disorder. The second one is hallucination. Hallucinations are sound or other sensations experienced as real when they exist only in their mind. The third one is disorganized speech. Schizophrenia can cause the person to have trouble concentrating and maintaining the train of thought, which may manifest itself in the way they speak. Like for example, they may respond to questions with unrelated answers, start a sentence with one topic and end somewhere completely different and illogical things. The fourth one is disorganized behavior. Schizophrenia dispute goal-directed activity, impairing the ability to take care of yourself, your work, and interact with other people. Disorganized behavior appears as a decline in overall daily functioning, unpredictable or inappropriate emotion responses, behavior that appear bizarre and have no purpose. The last one is negative symptoms, refer to the absence of normal behavior found in healthy individuals, such as lack of emotion, lack of interest, and many more.
Hi, my name is Ainatul Nur Nadira binti Nur Azizan and my metric number is 191221493. Today I would like to talk about schizophrenia, the effect of schizophrenia. In my opinion, there are a lot of effects of schizophrenia. Okay, the first one is mortality. Although schizophrenia is not in itself a fatal disease, death rates of people with schizophrenia are at least twice as high as those in general population. Before this, mortality has been related to poor condition or of prolonged institutional care. But however, in this recent study, it shows that people with schizophrenia living in the community suicide and other accidents as leading cause of death. Secondly, social disability. According to WHO, impairment represents any loss or abnormality of psychological or so on considered normal for an individual in his or her social culture setting. But for schizophrenia person, this ability can affect social functioning in various broad areas such as self-care, which refer to personal hygiene, dressing, and also feeding. And it also affects in occupational performance, which refer to expected functioning in paid activities, studying, and also homemaking. Okay, the third one, schizophrenia affect the social stigma. Social stigma refers to a set of deeply discrediting attributes related to negative attitude and belief which likely to affect a person's identity. Various adverse effects may arise from the stigmatization process, which is barriers to housing, employment, restrict access to social service, fewer chance for marriage and others. Okay, so here a little bit the effect of schizophrenia. Thank you.
Good morning everyone, my name is Chang Jiajin. Today I would like to talk about the solution of schizophrenia. Is the advance of long-acting antipsychotic is not only suitable for the treatment of the patient who refuse the drug, but also facilitates the understanding of maintenance treatment for the patient in remission, thereby reducing the recurrence rate. The oral long-acting system mainly consists of the pentafluorido, and the therapeutic effect of the oral gas, about 30 to 60 mg, can last for 1 week. At present, the most widely used injectable long-acting preparation in China are flufenazine diclonate and ondouracil. The duration of one injection is 3 weeks and 4 weeks respectively. And the second is insulin coma treatment has a better effect on the delusion and adolescence schizophrenia due to the complexity of the treatment methods, the needs for the spatial facilities, trainees and personnel to monitor, and the limitation of the long treatment periods. It has been almost replaced by the convenience and safer antipsychotic drugs. And the third is the antipsychotic drugs can effectively control the acute and the chronic mental symptom, and they improve the clinical remission rates of the schizophrenia. And those who insist on the maintenance treatment during the remission period can avoid the relapse, and they often play an active role in the preventing mental decline. And the fourth is the electric conclusive therapy has a significant effect on the people with the severe excitement and the stopper excitement, agitation, injury, self-injury, and the negative emotion. After the symptoms are controlled, they should be treated with the psychotropic drugs. And thank you.
In my opinion, schizophrenia disease is dangerous because it has many bad effects. I think everyone should pay attention to this disease. Maybe this disease seems like a normal, but actually this disease can harm all of us. Schizophrenia not only affect the sufferer, but also suffering to the sufferer's family. Schizophrenia patient in the onset of the disease, his thinking emotion is not controlled by himself because it is controlled by the disease. So often lead to the reality of the perception and its response is abnormal because the patient only believes in the things in his hallucination. His word and deed are dominated by mental symptoms, and he do the things that harm others and himself. Patients with schizophrenia are 2 or until 3 times more likely to die early than the general population. Schizophrenia often destroys not only one person or other family, so we must actively prevent the occurrence of schizophrenia in our life. If something happens, communicate with your family and ask them to help. However, it is found that the family member has the severity of schizophrenia, and it is necessary to actively make schizophrenia adjustment to avoid embarking on the path of schizophrenia.